Okay, today we're going to be looking at how AI is changing patient search. As everyone's probably aware, search behavior is drastically changing. So we're starting to see massive drops in traffic across verticals, across the internet. People just are not getting to providers' websites anywhere near like they used to, and a big reason for that is because of AI answers and AI results. Whether that is people using actual bots and AI bots like ChatGPT or Perplexity or Claude or Grok, or they're just looking at the results within Google itself because AI responses are often answering the questions for people. So there's a lot of hype, there's a lot of hyperbole around AI and what it's doing and what you can do with it. This training is not about the production side or how to use it for operational streamlining or to create content. This presentation is going to be 100% focused on how patients and families are using it to search for healthcare services and providers, and what providers and marketing teams in particular need to do to make sure that they are prepared for this. Because it's happening now. We're already seeing it significantly in the data. It's also, from our perspective, going to accelerate quite quickly, and within the next 12 months, for providers who are not making this shift, they're likely going to be following seriously behind in the search to connect with patients. So we need to understand how AI search works. We need to understand search behavior and user behavior around how they're using these tools, and then what we need to do as organizations to make sure that we are successful and still continuing to show up in those results. So this one just mentioned fewer website touches, right? If you look at your website traffic, it is going down. It has been going down for probably at least the past 12 months for most providers. Reason for that is all of these informational articles that you used to have people visit your site for, they're not visiting for anymore. Now, we haven't really seen this translate into less qualified inquiry volume or less new patients for our clients, and that's because people are still using websites to make a final decision. They are just not going to visit the websites for third or like tertiary information that's not super important to them. So maybe things like, what do I need to think about when using a weight loss drug? Or what are the side effects or GLP-1s? What is cognitive behavioral therapy? How does that look like? How long will it take me to fix a toothache? Or how painful is a root canal? These are all really general inquiries that no one needs to go to a website for anymore. They are just going to type it into either an AI bot or get the AI query response from Google or Bing, and they call it good. So a lot fewer website touches. People are also using a lot more very specific queries than they used to. So we used to look for weight loss surgery or addiction treatment or toothache, dentist, cavity filling, very general kind of just keyword based searches. That's not what people are doing anymore. Because you have to be specific with the prompts that you're typing into AI. And we're also seeing a lot more of a shift to voice searches. So people doing a voice query and then getting a voice response from Alexa or Google or the chatbot that you're using. So you will see people type in things like, can you give me the top 3 dentists within a 15-mile radius of me who accept my guardian insurance? Right? Very long string of queries. AI takes it, spits out the responses. So they're getting very specific. You're also seeing things, very little things like, what's the electronics policy at this provider? Or when I get there, where do I need to park? Is a surprisingly common query that most websites have not answered in the past. Or what's the qualifications of the staff at this provider and how do they compare to other provider over here? And AI will pull those responses. And I'll take a look here further in the presentation to see an example of that query response. Third-party validation is becoming incredibly important. So Google has always used backlinks as one way to establish credibility for a website, but AI is significantly accelerating that shift and is much more focused on third-party validation. So AI goes in just like a person, and this has always been the case. It's just that it hasn't been quite as in your face for providers. People do not search for something and then click and call. That's not, or schedule an appointment or become a new patient. Like, that's not how humans operate. They evaluate websites, they evaluate the information on those sites, they compare it to other websites, they look at Google reviews, they look at other online reviews to try to get a sense of, is this provider legitimate? Do they actually do what they say they do? I need to look beyond or behind the marketing speak to really understand what they're good at. AI is doing the same thing. AI is doing that, but it's doing that rather than it took me 15 minutes to 2 hours to do real deep research on where I want to send my loved one for surgery or treatment services, or where I'm going to get a root canal that I'm super scared about. Now you can just look and AI will do it in 5 to 10 seconds. So third-party validation is really important, and this can be news sources, it can be a local chamber of commerce site, it can be an adjacent healthcare provider or a hospital system that's mentioning you. AI wants to validate that the information that is on your site is credible and is accurate. And so there's a lot of third-party cross-referencing, just like humans do. It's much more individualized than it used to be. Google has been doing this for a long time as well, and people often don't realize it. But if I have an employee that is sitting at the desk at the facility, and then I have maybe the owner or the CEO or the program director, and they're at a conference out of state. If we search for health service X, same exact search, we will get two very different result sets, because Google is using your location to provide the result set for you. It assumes that if you're looking for healthcare services, you are looking for healthcare services near you. So the result sets will be completely different. Google does this on really a mile by mile, and actually as specific as it can get, radius. So if I have that employee sitting at the facility and they're typing in the healthcare service search, and the CEO is over at the coffee shop a mile and a half down the road, again, you're still going to get different search results. It might be more similar because you're closer, but there's still a difference in rankings based on where you are geographically. On top of that, and again, Google has been doing this for a while, they individualize results. So when you're logged into Chrome, if you're using Chrome as your browser, Google gets an idea of who you are, how old you are, what you generally search for, what's important to you, what your income level is, and it will individualize your search results. So same scenario, you could have the CEO sitting literally right next to the employee, both doing the same exact search, and the employee has your services ranked number 1 and the CEO shows up on position 6 on Google. Happens all the time. Google is individualizing search results. AI is again amplifying and accelerating this trend. So AI, the bots really get to know the individual users that are using them, and then will also individualize results. And it's becoming much, much harder to have a very general ranking. Now, of course, there's still personas, and from a marketing standpoint, we don't have to reach every single individual user and understand their personal psychology, because there are commonalities that are important to people. Whether it is a mom searching for treatment for a son or a daughter, or it's an individual looking for a root canal, or it's someone, maybe it's a middle-aged man that is looking to lose weight and wants to use surgery as a way to do that. There are commonalities across those profiles, right? In terms of what people want as a solution, in terms of their kind of psychology and overall behavior. Even take a real simple example like the middle-aged man that's looking to lose weight through surgery. He's going to have a similar search history, over the previous 7 days or the previous 2 months. So that's going to be built into a profile, whether that's a Google response or an AI bot response. That doesn't matter so much. So as long as you're doing good marketing, which has always been around personas, you'll be able to adapt to this. Just understand that the result sets are definitely going to be more varied and more different, which is harder from a tracking and reporting standpoint in particular. Different bots also have different answers. Claude is different than Grok, is different than Perplexity, and we'll take a look at that in a second, just as some of the source information that they're using. But they're all trained differently. They all have slightly different operating code in terms of what their goals are, what their orientation is. And so we'll probably see probably ChatGPT or something will come out on top. But just like Google is the primary search engine used by the vast majority of people, you're going to have one AI bot or one LLM that's going to be the primary bot that's used by most people. Location changes it, personalized results, mentioned that. All right, so again, a little technical. We're not going to get super technical here. You don't really need to understand the back end of how AI works and what a token system is and how they're doing prompt engineering. Like none of that really matters from a marketing standpoint. You just have to understand the basics. So first off, just realize they are aggregating the query responses. Again, Google, right, if we go on Google, I've got the top 10 results. And what Google is saying is like, hey, your information is somewhere in here. Go find it. And hopefully we got you really close to it on the page. But my answer might be buried on the page. And so Google's gotten better about this. It pulls out a snippet, pulls out a rich snippet or a query response, and AI is definitely doing that now. But I used to have to go and dig around on the page to find what I want. AI doesn't just give you a list of potential areas where the information might be. AI literally gives you an answer. And then it does it in a very conversational way. Super helpful, but very different. So the underlying machine language and kind of logic in terms of how search ranking works and query response works isn't changing a ton per se, but the way that the results are displayed is very different. So it's an aggregated response. Basically, your AI bot looked at 40 different sources, made some decisions really quick, cross-referenced all that information, looked at validity, looked at trust, and then gave a response using that assimilated information. So again, just like a human would, I'm looking at tons of different sources to generate an idea or a feeling or a decision. AI is doing that for me now. On that note, multi-entity signals are really important for AI. So again, Google just goes out and lists all the information. But AI is taking a look at your website. It's taking a look at online reviews from multiple sources. It's looking at other third parties that are talking about you. Are there any mentions of you in local media that's online? Are there mentions of you in related providers? Maybe you guys attended a local conference, or you had a mention by an adjacent healthcare provider that said something about you on their blog. Social media accounts are starting to be pulled from. What are other organizations saying about your social media or about you on social media? So AI is pulling in all that third-party information, which makes it really difficult. And this is a big shift for marketing teams, for marketing agencies. Your website used to be your primary entity. And what you were saying about yourself on your social media profiles was kind of your primary entity where people went and looked for this kind of information. That is completely changing. AI is cross-referencing lots of different entities around the web to get an idea of who you are. And again, they are comparing what you say about yourself versus what other people are saying about you, and does that match? So humans have done this. Again, I go to the website, then I look at online reviews, then I check a Reddit thread about your about your organization, about your services, see if you're actually doing what you're saying you're doing, or if you're really as good as you seem to be claiming you are. AI is doing that now to a much stronger or more accelerated. AI is doing that to a more significant degree. At this point, doing it much faster than people used to. So SEO still matters. It still matters a lot to show up in the rankings and the search results. So your website might not be the end point of that search, but we still need to be ranking on, for example, page 1 from a normal SEO standpoint, a normal Google ranking standpoint, for AI to cross-reference us. If you look at something like what's the causes of a toothache, or what kind of weight loss surgery should I use? Or what is the best therapy for someone struggling with depression? There's probably 400,000 articles out there on the web. And Google's job and business model has always been to take that information and show you the best 10, right? Because no one ever goes to page 2 on Google. So hundreds of thousands of pieces of content on the same topic, we want to show the most relevant to someone. AI is doing the same thing. AI is not going through all 400,000 pieces of online content to make a decision and provide a query response. It is looking at the top 10 pieces. And so it's already got that information, or it's already got that determined through the Google algorithm, and says, okay, we'll look at these top 10, make some decisions, provide a response. So you still need to be showing up in SEO. Now, AI and the way it searches is a little bit different than the way that traditional Google algorithm works. So it's not going to be exactly the same. And we've seen that pretty consistently in our data and our result sets. We might have a client ranking #1 from a normal Google standpoint, but if we put that into ChatGPT or Copilot or Gemini, we'll find that there are actually different rankings. And so maybe it used our client as a source text, or maybe it doesn't use our client as a source text. So they are slightly different, which is why you have to understand optimization across the board. You can't just focus on SEO, but by and large, when we look at a client that's ranking on page 1, they're almost always cited in the AI bot search responses as well, because there's this pretty strong overlap in the way that this machine language is working. Here's a real quick example of one of the differences. So someone might type in Scottsdale addiction treatment. Super common. We get that all the time. Now you have what's called a fan out query. So AI assumes that there's going to be all of these related questions around that. And because it can do it in a couple seconds, it's happy to go out and do that and understand all of these different questions. So you notice there's questions around there in cost, in helping a loved one, around insurance or luxury services. That is all being built into the AI's query response. So in normal SEO, those used to be all separate pages. And still to some degree, you will have separate pages on there, but you want to make sure that you have those pages because AI is looking at all that information. And then there's also a shift around how we look at the site and putting some of this information directly on the home page or on an About Us page or a location page or a services page, having some of the information right there because there's still crawl time. So just like Google has crawl time, like it's not going to crawl your entire 2,000 page website every single time it's looking for an answer to display a result. AI is also not going to look at your entire website. So what is the interlinking? What is the relevance of the information? How deep, how many links deep is it to get to the information it needs? All of this stuff uses crawl budget. So we do need to have a very strategic idea of the interlinking nature of the content, understanding what the fan out queries are going to be. So we've got them linked or cited right on the appropriate pages. So this is one of the things that's changing when we look at SEO versus AEO. All right, I want to take a quick look at some example queries just so we can get an understanding of how this is playing out. So here you can see an example of where we did a search for dual diagnosis treatment. So what is dual diagnosis treatment? And AI gives me a response right here. I don't have to click to a website. Now it gives me the option, and notice it's got 9 different sites it's pulling from. So I can go through and kind of get an idea of what these sites are, but most people don't care. I don't really care where the information is coming from so much, as long as I'm getting my answer. Now, if I got an answer I wasn't clear on, I might do a little bit of more research, but really most people will just ask a more specific query. They'll ask a better prompt to get the answer that they want. So this is why you're losing so much traffic, is because all of these very informational pieces of content that you used to rank for and used to get traffic to the website are no longer driving actual traffic. Now, does this really matter? Yes and no. Again, we really haven't seen a loss in patient volume or inquiry volume across our clients across the country because this is not a high intent search term. This is not someone that's looking for services today. They're just looking to gather information. So you're not losing a call because you wouldn't have gotten a call off of it anyway. Also notice in healthcare, actually AI still has some rules around it. And so maybe I want to say here, like, what does someone high on cocaine act like? And you'll see here that I'm not getting any kind of AI response. And the reason for that is AI still, or Google and the AI bots in general, have protocols built in to protect things around health information. So certain things still will not get a query response by design. And something like 40% or 50% of all searches do not get any kind of AI summary. And that might be a direct coding issue from Google or the bots to say, hey, don't display this kind of information. Or it just might be that it's not considered relevant and some of the links are actually considered better, so it'll still display them. But just realize that that is part of what's happening. Now, the next thing I want to look at here is an actual ChatGPT conversation window. And this will give us a really, really clear idea of how search is changing and what the differences are. So you can see here at the top, I typed in, what's the best addiction treatment program in Indianapolis? So it gives me some caveats about, hey, make sure you're evaluating this. I'm not perfect. It tends to do that a lot these days. But then it lists it. And so it says, based on what you're searching for, are you searching for residential? Are you searching for opioid use and MAT services? Are you searching for a more local provider, whatever? It gives me 4 primary responses here. This is where we need to be showing up as providers. Whatever our services are, we want to make sure that we show up in that top 3 or that top 4 list, because this is how people are searching now. Rather than going to Google, I'm just going to ask AI to tell me what the best is, and it's going to give me a series of responses. Now here's really how search behavior is starting to change. Rather than going to those websites and taking a look at them at this point, I'm going to keep querying AI. So you notice it mentioned evidence-based treatment in there. So my next query is, you mentioned evidence-based treatment. Can you give me a table comparison of your top 3 picks as to how they provide evidence-based treatment? And you can see here, again, it's very long-tailed, it's very specific. I've got a lot of information in there. This is one of the ways that search is definitely changing. People are looking for these long queries. We need to be designing our websites to make sure that we show up in these answers. And now you think back, again, as a family member of a loved one sending someone to a healthcare service, I might have taken an hour to do this. Go onto the website, see if they have an evidence-based treatment page, see if they have links to it anywhere, figure out how they're defining it, pull it into kind of I'm not going to run a table, right? Most people aren't going to do that, but I'm going to be thinking in my head, my comparisons. Nowadays, I just ask the AI bot to give me a table, and here it is. So really specifically, this is what their evidence-based treatment indicators are, therapy clinical approach, do they provide MAT, what levels of care do they have? It's all listed for me in a table, and then AI even ranks them for me. It says, okay, well, based on my assessment, here's what I'm seeing. Really important here is, like, do you have this information on your website? So one of the things that we're doing with a lot of clients is going through a lot of their claims. So they'll make claims around being a holistic provider, or they focus on individualized care or tailored programming or comprehensive services. All of those are just words. What does that mean? A lot of the times people didn't want to spend a lot of time on websites, so they didn't really search around to get clear definitions from a provider. But now with the way that search is changing, where it's so simple, it literally takes me 2 seconds of my time to have AI go do the work for me. Now we're going to get a lot more of these comparison queries. And so you need, as a provider, to have this information really clearly laid out on your site. If you're saying you do evidence-based care, what does that look like for you? And how is it different from competitors in your market? Let's say you're doing trauma-informed care, which is something a lot of health providers do for different service lines. Same thing. What does that mean to you? How do you actually implement it? Because I'm going to get it in a table like this from ChatGPT. Okay, so I'm not familiar with this particular service or addiction treatment in general. So I'm going to say, hey, really about question, what constitutes evidence-based treatment? I don't even know what that is. It's going to list it out, right? So ChatGPT just gives me an entire list of this is what this looks like. So from a marketing standpoint, we need to do 2 things. One, we have to be asking the AI bots these questions to see what its responses are. And then we have to be making sure our content is meeting these different levels of the query response. So it's a lot more work that goes into the content than previously. Previously, we were just worried about ranking. We wanted to see what other pages were ranking. We want to provide higher value content, better content. Now we really have to understand the thought process of how AI thinks and how it evaluates particular terms, because that's how we want to be showing up in the responses. All right, so now I'm getting really specific. I'm saying, hey, I've got Cigna Health Insurance, and I'm kind of looking at RCA. Does RCA accept that? Is that answer on the site? And so here it's not clear. So according to ChatGPT, it says they're in network along with a couple other providers, but they note that verification is required. They said your coverage may be dependent on certain plans and deductibles, so I'm not quite sure. So instead, I'm going to tell you to ask these questions to verify, because as ChatGPT, I'm not sure of my answer. I think you should follow up in person. I can put this into a table again, right? I could say, hey, do these 3 providers I'm looking at take Cigna Health Insurance? get that into a table. And if you don't have clear information on your website about a yes or no, then you're going to look deficient in that result set, and you're maybe going to be culled from the short list, or they're going to decide not to call you because that information is not there. Same thing with like pricing. A lot of people are very vague on pricing, and that's hard as a healthcare provider. It's dependent on insurance, it's dependent on deductibles. But if you don't have clear information on there, you're either not going to show up in a query response, or you're going to have blank or limited information versus people that do. I also just want to pull out here, as we're looking at these different providers, let's look at the sources. You can see there's all these sources it's pulling from. Also tells you how long it took. But we can see all the different websites that it's pulling from. And there's literally dozens here that it's pulling from in terms of trying to understand. I mean, even pulling from SAMHSA's Facebook page, right? So that is a big shift for the way that we need to do search engine and AI optimization, because we have to worry a lot more about third-party sites. All right, so I have an understanding of evidence-based treatment. I understand if they take Cigna. Now, I'm like, well, what's the admissions process look like? Is this complicated? Can I have my phone? How long do I need to be in treatment? These are all really normal questions that might before have been answered on the phone, but now I'm just going to ask ChatGPT what that process looks like. This means that as a provider, if you don't have this information for these standard queries on your website, that AI is not going to be able to deliver a response. Now, if I'm asking this about other providers and I do get a response, the ones that didn't have that information or didn't have it clearly laid out are less likely to get the actual inquiry. So we have to really be thinking through the psychology of people about what they're asking, and then do we have that information available so that will show up appropriately in AI query responses. All right, so I've decided, like, okay, I'm kind of thinking between RCA and Fairbanks here in Indianapolis. Why would I choose one or the other? What makes each stand out? And again, I get a nice little table here. Tells me the main standouts. Tells me about access, levels of care, evidence-based positioning. Right? All of this stuff is really, really important, and you'll notice that it is pulling from slightly different sites. So, like here, it's pulled from eCommunity. So Fairbanks is now part of the eCommunity hospital system. And so it's pulling from there rather than directly from the Fairbanks website, for example. But it's also still cross-referencing stuff. So it'll say, hey, look, I'm pulling information from recovery.com. I'm pulling information from Google reviews to help you understand what an actual answer is here. And so it breaks it down. So are your differentiators, the things that you think you do well, what AI is recognizing? It's a great check, because that should be very clear. Should be very clear when I run a comparison what our primary differentiators are versus competitors in the community. If AI can't pick it out, then people definitely can't pick it out. We want to make sure that that's super clear on our website and all of our communications. All right, so I got an idea here. I'm starting to get it. What are the success rates of those two facilities? And so here, again, a really good example. I did not find a clean, independently audited success rate for RCA or Community Fairbanks. Big miss. There's nothing there. I want to know, if I send a loved one to this provider, what's the success rate? Are they going to get the result that they want? And if your competitor has those success rates and you don't, I'm probably going to give them a call first. Or maybe I'm going to call you from the list if 4 other competitors have outcomes metrics and you have none. So really important. Again, it'll give me a bunch of questions to ask, which is quite nice. They want to know what's the cost. What is this going to cost me? Put it into a table, please. Here, very limited. Not enough information on either of the websites to tell me if there are what my actual costs are going to be. That's a miss for these providers. Can you please summarize the good and bad of online reviews? So this is another one that, again, we'll see a lot in search behavior. People used to go and look at the reviews. I don't want to sort through 250 online reviews. I can literally ask ChatGPT to spend 20 seconds, go and do that entire search across different review sites and give me the aggregated information. So this was actually very interesting, because if we look, Community Fairbanks, they say positive themes include long-standing reputation, structured care, group support, etc. Rehabs.com lists review keywords as staff, facility groups, etc. And Fairbanks also ranked #1 in Newsweek. So those things are nice. But then you get to the negatives and you're like, oh, well, Here at Fairbanks, the negative reviews I found commonly point towards frustration with the MAT clinic, office staff, insurance issues, and treatment effectiveness. So it's giving me the information that, hey, maybe this isn't exactly what I thought it was. And here we get a bottom line response. Fairbanks still looks credible, especially because of its long local history and Newsweek ranking, but the public review ratings I found are mixed, around 3.3 to 3.6, with more visible complaints about office experience, MAT clinic experience, and treatment effectiveness. Now, reviews have always been super important, and they're going to have a serious impact on your ability to rank. Google builds them into ranking factors in general. AI uses them to understand the validity and the trustworthiness of a provider, and so it'll look at reviews before deciding to include you in responses. And of course, humans do it, but this is so easy for me to see and say, well, Fairbanks is saying that they're, this, that, and the other, and they're very good, but that is not matching their online reviews. So I'm getting less of a positive feeling, because it tells me right at the top, based on online reviews alone, RCA looks stronger because it's larger volume review sources showing around 4.4 stars, and positive themes repeatedly mention staff, alumni support, and recovery impact. So really clear here that it's just breaking it down. Now, I do want to show one other thing. In the negative reviews, they also went to Indeed and they searched up staff reviews. And so for RCA, it says employee reviews on Indeed raise concerns about workload, staffing, management support, and workplace culture, which may or may not reflect the patient experience directly, but are worth noting. So now it's not just patients that we have to be concerned about, it's also our staff, because AI is going to pull that into any kind of query response. So as you can see, this is really where search is evolving to. All of this is done without me ever looking at a single provider website. Now I might, if I've really got my short list, I might go and actually check it out, because most people do want to see the site for themselves, but I can get the vast majority of information I need. I don't have to waste my time trying to find the insurance page, trying to find an evidence-based treatment page, looking at all the reviews. I can just do all of this in the 15 minutes it took me to write some queries, read the responses, do some follow-ups. Very big change to how search used to work. We need to be showing up here as much as we need to be showing up on Google. All right, coming back, we're talking a lot about AI using all these different sites. You saw, the dozens of different sites it was using to source the initial inquiries. You've probably heard a lot that AI loves Reddit, for example. That's not true across the board. So AI and Google are very sophisticated, and they understand that there are different verticals. And that's why when you search certain topics, you might get all informational responses or local provider responses, because Google understands from your search intent what you're trying to do, and it will adapt the search results appropriately. For behavioral health, as an example, AI prefers recovery.com as a primary source versus Reddit. Reddit's down here, more towards the middle. It's not cited as much. Reddit might be more interesting for general concert inquiries and things like, where's the parking? How long are you have to wait for an Uber? Does it get crowded? What's the food like there? Right? That's stuff that might be on Reddit. So when you look at conference information, AI is going to pull from there a lot. Whereas for a restaurant search or query, it's probably going to pull from Yelp and OpenTable. You're just going to have different primary sources based on the vertical and based on how the AI bots were trained. So for behavioral health, we can see that recovery.com is primary on ChatGPT, Copilot, and Perplexity. Now, be aware though that even though this is the highest cited website, when we actually run the total numbers, it's still only about 3% of total queries. So while it's the largest in terms of overall share, it's still 3%. Most of what AI is doing is looking at dozens to hundreds of sources very quickly to evaluate them and aggregate it and then provide a response. So what does this mean for providers? We have to be on a lot of these different sources because we don't know which one AI is going to pull from. 3% of the time it's pulling from recovery.com, 97% of the time it's not using it. But that 3% is still cited at least one of those times. And just because it's not cited doesn't mean it didn't use it, right? When you saw the citations, it's only showing you the primary ones, especially with AI search results on Google. They're only going to show you the main query responses that it used rather than the other 100 websites that it also took a look at briefly. So we have to start thinking third party a lot, and a lot of our time needs to be spent on, do we have accurate information on all these third party sites? Are we saying the same thing across all the third party sites? Even simple stuff, SEO has always had a little bit of focus on what we call the NAP, name, address, phone number. It needs to be the same. It can be really confusing to AI, just like it's confusing to people. Let's take an example of the Meadows. So we have the Meadows Behavioral, we have Claudia Blackson by the Meadows. Right? Who are you? What is your name? If that's not consistent across the web, that can confuse people, it can confuse AI. How many dentists have the name Gentle in the title? Probably hundreds across the country. How many healthcare providers have Serenity somewhere in the title? Again, hundreds across the country. So we need that consistency, because otherwise AI and people have a hard time figuring out who we are. So that's just one real basic level. But then we want to look at things like services provided. And are we being understood from these third-party sites? We don't want other sites to get that wrong. So we need to make sure we're talking to these sites, we're updating information on these sites. Some of these sites are pay to play, so we have to make a choice. Do we want to pay to be able to update and edit our information on these sites? Is it worth it to us? And that's what some of this research can do. So if I was looking at our addiction treatment provider, for example, I'd say if we have to pay for recovery.com, let's do it, because that's going to be worth it for us in terms of how often it's used by AI. Whereas if we're looking at goodtherapy.org, that's way down here, it's only got 12 citations, and then there's stuff way, way lower. Am I going to be concerned with it? If it's a pay-to-play platform, I can probably skip it and save some money. Another big piece that's changing with all this is the growing importance of the human element. And this has always been the case. When you go to a website, would you rather see actual pictures of the staff and facility, or do you want to see stock photos? But actual pictures of the staff and facility cost more. I have to go and hire a photographer or a videographer to come in and do that, versus just paying $1 from Adobe stock photos and putting it on the site. So there are, as always, costs and benefits, pros and cons to these different elements. But people don't want derivative AI slop. It's such a huge problem across the web now. We'll take on new clients, and we'll see, starting in February till now, which is May, in 4 months, they had a slew of new content come out, just hundreds of pages. That wasn't done by humans, that was done by AI, and that's slop. Like, people don't want it. They want to see real information, local information, and Google hates it too. So Google had a big update way back in March of last year in 2025 that killed a bunch of AI slop, and then they just did it again this April. And so tons of websites just completely lost all their rankings overnight because Google said, you're not real, this is just AI generated derivative crap, and so we're not going to rank that content, we're not going to rank your site. The human element is becoming much more important. But with the proliferation of all this AI slop, I mean, the amount of spam that we're getting, whether it's through email or LinkedIn or Facebook, or just seeing 1,000 pages on some random local healthcare provider website, immediate red flag that this is just a bunch of junk that no one spent time on. That they literally typed a prompt into ChatGPT or Claude and had it start spitting out content. That's not going to help me as someone that's trying to make a decision of which provider I want to go to. It's also not finding locally relevant information. So that human component is going to be more and more important. Are you offering real value? Are you showing your real services, real people, real facility? And then again, like we just looked at, is that cross-referenced across the web? So your website is no longer really the center of the marketing engine, it's the starting point. And then what people are saying about you, what pictures they have about you, what references they have to you on their sites is where we need to be spending a lot more of our time. So are we humanizing that piece as well? We want to be answering questions in a real, not just conversational way, but real answers. Like, what insurance do you take? How expensive is your program? What does evidence-based treatment look like for you? Those are all things that as a person searching, I want to know. I'm not just trying to show up for the bots. I'm not just trying to show up for SEO or marketing speak. I want to make sure I'm legitimately answering that question, because as we just saw, a lot of people aren't even going to be reading our language on the site. It's going to be AI that pulls it, summarizes it, and then gives a short snippet about the overall final response. And so if we just have a bunch of marketing speak in there, that's just confusing to things. We need to give a clear signal to AI. Is like, here's the cost. Here's the insurances we take. Here's how we do evidence-based treatment. Those have to be very front and center and clear to show up appropriately in AI responses. Then when people do go to the site, they want to see that human component of it a lot. So the facility and staff pages. Who am I going to see? What are their qualifications? What's their experience? Those are things that I want to know versus going to a site that just has a bunch of stock images or a bunch of marketing gobbledygook. Right? So I go to a hero image and it says, we provide top of the line transformative care. What does that mean? How is it top of the line? How is it transformative? And there is a picture of two smiling people. Who are those people? Or are they former patients? Are they staff? Or is it just a stock image? That stuff is not speaking to people because there's so much AI slop where AI is creating images, AI is creating videos, AI is creating content. I want to know that I'm dealing with a real person and that this isn't just AI junk that's being generated but doesn't actually speak to what the healthcare provider is doing. So we want to humanize as much of our content as possible. That creates a lot of effort, it costs a lot of time. We often have clients that will come to us and ask us for like task-oriented deliverables, and so they'll say, well, how many pieces of content are we going to get a month? Are we going to get 4 blogs a month? That's always been the wrong way to look at things, but increasingly so now. Google does not want a ton of random content on your site. AI is going to ignore most of that random content. They want good content. They want content that's specific to the location or the community that's being served, the personas that are being served. They want to understand how you are differentiated from competitors in the marketplace and in your marketplace. That is what's becoming really, really important, which that takes a lot of time. So now, rather than the amount of content or the quantity of the content, you need to really focus on the qualitative nature of that content and how you are standing out. That means interviewing staff, that means interviewing community members, that means linking to community organizations that are appropriate or having them link to you or reference you in their social media profiles. This is the kind of activity that's become super, super important. It always has been, but AI is just making it a lot more visible for providers. So what do you have to do? Here's laid it out. These are a lot of the changes that's happening with search. This is how AI is coming in and changing the way that you show up in results and the way that you need to show up in results. So what updates are we making as a marketing agency and that you guys should be making as well if you are working with an internal team or someone else? The content focus I just talked about, the more multimedia you can bring in there, highlighting real people. You have images of your facility. You have images of your services or the technology that you're using. You have videos of your actual staff talking about the services that are being provided. Is that on social media? Is that on the website? That kind of stuff really helps you stand out from all the AI generated content slop that's coming out there. So multimedia is big. Local information. Do you just have a general blog or a general service page that talks about the services the same way every one of your competitors does? Or can you speak to the community and other partners that you have there, the staff that you're working with, maybe localized trainings that you're providing or specialized services? You have a certain piece of technology that your competitors don't have. That should all be front and center and part of the content that you're creating. It's got to be tighter. There was a large trend for probably like the past 5 to 7 years where more content was better content. The more traffic we had come to the site, even if it was on these like really obscure search terms, because we already did all the content for the primary services and the treatments and the staff, and so now we're getting to this really tertiary information that people don't often search for, but more traffic was better. Once in a blue moon, we might get a call off one of those pages, and the more traffic we had, the more Google thought we were a highly ranked site. Now both Google and AI don't really like that. They want to see a tight focus. They want to see, okay, you specialize in this thing. This is what you're an expert at. We are an expert in dental services. We are the best hospital in the region. We provide amazing cancer care. We provide the best mental health services, and this is why. But they want it to be really tight. So all this really long tail random content Google and AI is not paying attention to anymore. And the more focused you are, the more it understands that this is your area of expertise. All that other content gets kind of confusing. It says, well, they have all this content about celebrities and celebrities seeking care services. So are they a celebrity gossip mag, or are they a healthcare provider? These things we don't want to be confusing Google or the AI bots, so we're looking at tight focus. So you're going to see a lot less content, or you should be seeing a lot less content if you have an internal marketing team, and a larger focus on higher quality, really detailed content. So it's not about pushing out 4 pieces of content a month. It's about pushing out a really good piece of content, or maybe a good handful of pieces of content. But that's going to be much more valuable than quantity. No AI slop, obviously. Regular updating freshness is a quality indicator and a signal, especially for the AI bots, but also for Google now. We're often seeing that if we have a client where we recently updated that page, and that doesn't mean we had to add new information. We might have. So we might add some new content, or update a quote, or change some location information if there's something that's changed there. That helps us regularly update content, but it can be just going and touching the page and making sure that we're refreshing it on a regular basis. So we're going to be spending a lot more time updating existing content and making sure it's fresh, rather than constantly creating new content. So that's a very, very important shift. Again, here, you're not getting a lot of task-based outcome from the results. Of I wanted 4 pieces of content, and you guys just went and updated 15 different pages instead of creating new stuff. That's where you should be focusing your time. So your expectations around what successful activity looks like is going to be very different. At the end of the day, the only thing that matters is, are we generating the same or more qualified inquiries that are leading to new patient volume, right? We don't want to be losing traction. That's no good. So if we can maintain and then add, that's the goal. So as long as we're seeing that inquiry volume come in, as long as we are seeing the new patients come in, what we're doing is working, whether or not there are 10 new pieces of content in a given month. It's more about strategy. It's more about really understanding what's moving the needle than quantity. Related to all this, because search is becoming so much harder to show up in, you have to have outbound campaigns. So many providers really rely on bottom of funnel search. So they're trying to show up in Google, they're trying to show up on Google Ads, they're trying to show up in AI search results now, but that's all bottom of funnel stuff where people are making a final decision. All of the other campaigns and content that we're creating is just being ignored by Google and AI, so nobody's seeing it. So how do we build trust and awareness with communities and audiences? You need push campaigns through Facebook, through LinkedIn, through email, through TikTok, through Snapchat, etc., because that's the only way that people are going to see your content. They're not going to see it when you post for free to your Facebook page or your LinkedIn page. All of these platforms are pay to play. They throttle the organic reach of that content. The only way you get it in front of people is pushing out there for paid campaigns. And that also allows you to have another channel and a diversification. So if you're not showing up in AI search results, or if you're never going to with all your informational content, because AI doesn't really care about that informational content on your site anymore, you've got to be pushing it out there. So paid media spends through outbound campaigns is a really important focus that every provider has to be building into their marketing mix. Basic FAQs, things we talked about in the beginning. For example, what does it look like when I show up at your office? Where is parking? What do services look like? Do you have an electronics policy? What's going to be the follow-up? Do I need to do anything for my insurance? These are just really normal inquiries that someone might ask a call rep when they call in, or the front desk manager, or the secretary. Those questions should be answered on the website somewhere so that AI can find them, because people are going to be asking AI these basic searches. The About Us page we're finding to be incredibly important. AI actually uses the About Us page frequently when answering many of these queries. So you want to make sure your About Us page is really, really robust. Staff page, same thing. We're looking to humanize the content. The best way we can do that is have some or all of our staff on a staffing page so I can understand experience, credentials, specialties. I want to know where I'm going, and having actual people with all that information allows me to know that it's not AI generated crap. This is actually the provider and what they're doing. Expanding internally linked content is something that we're doing across the board for all of our clients. The thing I mentioned in the beginning, we're talking about transformative care, we're talking about trauma-informed care, we're talking about evidence-based practice. It can't just be marketing jargon. For AI and for people, I want to know what that means. So if you say evidence-based treatment, that should be a clickable link that then I can go and understand how you specifically deliver evidence-based care. Right? I don't want a general article on what evidence-based care is. I want to know about how you as a provider do it. How are you doing trauma-informed care? How is your care holistic or transformative? These are things that I need to know. Even simple things like say, hey, we've got these credentialed providers with us. That should be able to click to a staff page so I can learn more about them. Make it easy, make it really clear UX or user design that's friendly, that's intuitive, because that is what people want, and that's also what AI is using to answer a lot of the queries. We create things called trust boxes. They have everything in them, so little easy spots for people to just at a glance understand how you're different. What are your credentials? What are your accreditations? What are your differentiators? What are your locations? What insurances do you take? So just having a box on some of your main sites with that information is really good for the LLM AI bots as well as for people. Third-party site relevance is a huge move that is really the most challenging for marketing teams and marketing agencies. Before, it was easy for us. We could just go and create new content and that would start to help us rank, and then we could update that content and optimize it. Now it's a lot of third-party site information, and this is really difficult. So let's say that we've got a client that's listed on a hospital website. And so this is actually a real example. We've got a client that takes Medicaid and commercial insurance, and they're pretty large in the state out on the West Coast. A lot of people, a lot of hospitals don't have a lot of places to send Medicaid patients. So these hospitals are listing our client as a primary provider that takes Medicaid, even though our payer mix is 60% commercial, 40% Medicaid, and obviously for financial reasons, we don't want to have more Medicaid patients than we already have as part of that payer mix. So we don't want to be listed primarily as a Medicaid provider, but the hospitals are focusing on that because they know they can send people anywhere for commercial insurance. That's pretty easy. They want to highlight the ones that people have a challenge with. Well, now we've got to talk to that hospital. And you can't just talk to a hospital and get their website updated. You've got to find out who's responsible for that website. You've got to find out who's got permissions to make the edits, who's got permissions to approve the edits. So generally what we're doing is we're starting with case managers or discharge nurses and saying, hey, we've got some incorrect information here. Can we get this updated so it's clear that we're servicing both commercial and Medicaid patients? They're not going to make that change. The caseworker, the discharge nurse has no idea how the website works or even probably what information's on the website. But they're like, oh yeah, we do want our information to be accurate. Let me put you in touch with the web developer. We get in touch with the web developer. They're like, well, I can make the change, but I need approval for that change. Let me put you in touch with the CMO. So now we talk to the CMO. The CMO's like, well, I actually need CEO approval for that. CEO, not a priority for them. They don't really care what some random referral partner has in terms of information on their website. So their emails go ignored. So now we have to follow up with the CMO again and say, hey, can you ping the CEO? Can we get some response on this? Get this moving. That entire process takes months sometimes. Every once in a while we'll get lucky and we'll get through it in a couple weeks. But most of the time it's consistent follow-up because this isn't a priority for other people. We've got to find the right people to talk to. We've got to follow up with those people. We've got to get the changes that we want on the site. There's a lot of legwork to get one simple result. And so then you can come back as a client, either to a marketing agency or to your internal team and say, hey, look, you guys were working on this hospital thing 3 months ago and you finally just got it updated. Or maybe we're 2 months in and you're like, what's going on with that hospital thing? What have you guys been doing with all this time? But it literally took 30 hours of work to do the research, to make the contacts, to persuade and convince the hospital that this was important for them and they should be making sure they have accurate information related to the community. It's a lot of man hours and a lot of time spent for what maybe looks like a little result, but is actually super important. Because AI is looking at that and like what happened with this particular client is you said, what is our client known for? And one of the first things that AI responded was like, well, they're one of the best Medicaid providers in the state. Great, glad we're known for being a good Medicaid provider, but we don't want that being the primary response that AI is seeing about us. So we have to do these query searches. We have to understand how AI is looking at our clients Then we have to understand why it's looking at it that way. And so then we identify these hospital websites, and these hospital websites, that's what they're doing. They're listing us as a primary Medicaid provider. Now we've got to do all the legwork and the upfront effort to get them to change their listing. We're doing the same thing with content that's being created on third-party sites. We're looking a lot more at event sponsorship and event engagement in local communities, because that gets us listed on third-party sites. So there's a lot more work that's going in on the back end that's not as easily trackable in terms of final results. You're not going to be able to tie that to an inquiry channel like you could with a Google search or Google Ads. Now it's all this legwork that will eventually drive total call volume and new patient volume, but it's all of it together, right? Where are my outbound campaigns? What am I doing on our third-party sites? What are we doing on our first-party owned assets? All of this comes together in terms of what AI is cross-referencing and what people have always cross-referenced, to be honest, to make a shift for this updated marketing approach that's moving us into the future here. So results reporting, it's much more difficult. We're not saying, hey, here's how many calls we got from AI, here's how many calls we got from our third-party hospital websites. We're just looking at total new inquiry volume and understanding that all of this is having a positive impact. And we just have to think strategically, we have to think logically. If AI is telling people that we're primarily a Medicaid provider, but we're looking for more commercial insurance volume, we've got to solve that problem. And if we do solve that problem, we know for a fact that that's going to drive more commercial insurance. If we're already getting Medicaid calls as a result of how we're showing up across the web or how AI is viewing us, then we're absolutely going to get more commercial calls. But it's going to be very, very hard to do any kind of one-to-one correlation between those efforts. It's just going to be over time, we're going to see that increase in results, but not as easy to track from a reporting standpoint. So discussions have to be a lot more strategic. Here's what we're doing, here's why. We know that if we get all these community providers and their websites and their social media mentions to talk about us and our commercial insurance programming, that's going to have a positive impact. And so that's what we're going to work to do. And that might take 30 hours to get a single citation updated, or we might get it done in 15. But then we've got 4 other hospital websites that we have to work on to get this done for. Is it worth it for us to invest this time? And that's the discussion you need to be having with your agency or your team. Because a lot of times it will be, but sometimes it might not be, right? If I do an AI search and it shows up that, hey, we are showing up for commercial insurance, and even though these hospital websites have us listed as primary Medicaid providers, maybe I don't want to put in that time and effort because I don't think it's going to change the result set. So strategy, these discussions are super important to be having with your team as you're moving into the future of AI search. Hope that was a helpful overview. It is a lot that's changing, but it's actually a lot of themes that have really stayed the same. It's just the way that AI is operating is the way that humans have always operated. It's just that people are more aware of it now, that they're starting to understand how AI shows up in results and that we want to show up in results. If you have more questions or want to follow up on any of the information in this presentation, you can contact me directly, nick@circlesocialinc.com. That's inc.com. Go to our website, circlesocialinc.com. Connect with me on LinkedIn. We're happy to have a further discussion on this. Appreciate your time today. Good luck out there.